Right now. As you're watching this. A woman somewhere in America is dying from a stroke. Not because she didn't get to the hospital fast enough. Not because the technology wasn't available. But because when she walked into that emergency room and said the words, "I feel nauseous and dizzy," the medical team looked at her and thought anxiety attack. Her name is Lisa Chen. No relation to me. But that coincidence haunts me every day. Lisa was 38. A kindergarten teacher. Mother of 2 little girls. She woke up last Tuesday feeling like the world was spinning. She threw up twice. Had the worst headache of her life. And felt so exhausted she could barely stand. Her husband begged her to go to the hospital. Lisa said what millions of women say every day: "I don't want to be dramatic. What if it's nothing?" By the time I got the call to consult on her case 6 hours later, Lisa had lost the ability to speak. The stroke had destroyed her language center. Her 5-year-old daughter will never again hear her mommy read bedtime stories. I'm Dr. Sarah Chen. And I've spent 25 years fighting a medical system that is systematically failing women. What I'm about to tell you will make you angry. It should make you angry. Because the stroke that killed Lisa's voice, it was completely preventable. Here's the truth that's going to shatter everything you think you know about medical emergencies. When a woman walks into an emergency room with stroke symptoms, she is 7 times more likely to be misdiagnosed than a man with identical symptoms. 7 times. But it gets worse. Much worse. The symptoms you learned in school. The ones on every medical poster. The famous F. A. S. T. Test, fast drooping. Arm, weakness. Speech problems. Time to call 911, those were developed by studying men. Almost exclusively men. For decades. Women were literally excluded from stroke research because scientists thought our complicated hormones would mess up their data. So when Lisa walked into that emergency room feeling nauseous, dizzy, and confused, she didn't look like the stroke patient from the textbooks. She looked like a stressed-out mom having an anxiety attack. The triage nurse saw a young woman who could walk and talk normally. Lisa explained her symptoms calmly. Even apologized for bothering them. The nurse noted anxiety, possible migraine, and sent her to the waiting room. Lisa sat in that waiting room for 3 hours while brain cells died at a rate of 2 million per minute. She sat there feeling embarrassed. Wondering if she was overreacting. Fighting the voice in her head that screamed something was terribly wrong. That voice, that female intuition we're taught to ignore, was literally trying to save her life. But here's where Lisa's story intersects with mine in the most terrifying way possible. 2 years ago, I experienced my own medical emergency that changed everything I thought I knew about women and strokes. I was in my own hospital, teaching residents about cardiac emergencies, when suddenly the room started spinning. I felt like I was going to vomit. My head felt like it was in a vice. The exhaustion hit me like a freight train. I could barely hold myself upright. And you know what I thought? Standing there as a cardiologist with 25 years of experience, I must be getting the flu. I excused myself, went to my office, and lay down on the couch. For 2 hours. I convinced myself I just needed rest. Me, a doctor who had diagnosed hundreds of strokes. I almost missed my own. It was only when my vision started blurring that something clicked. I stumbled to the emergency department, my own emergency department, and demanded a brain scan. The residents looked at me like I was crazy. I looked fine. I was walking, talking, making sense. The CT scan showed a small stroke in progress. Small, but growing. If I had waited another hour, you wouldn't be hearing this story from me. You'd be hearing it from someone reading about me. But here's the most chilling part of my story. Even knowing what I knew. Even being a doctor in my own hospital. Even demanding the right tests. I still almost died because of the same bias that killed Lisa's voice. The emergency physician, my colleague, looked at me and said, "Sarah, you're just stressed. You work too hard. Go home and rest." I had to pull rank. Literally threatened to report him. To get that brain scan. And I'm a doctor. Imagine what happens to teachers. Accountants. Mothers. Students. Women who don't have medical degrees to throw around. This is happening every single day. Right now. While you're listening to me. Another woman is sitting in an emergency room being told her stroke symptoms are just stress. But what if I told you there's a third woman whose story proves that when we get it right, when we recognize women's stroke symptoms for what they are, the outcome is completely different. Meet Jennifer Rodriguez. A 33-year-old software engineer. Jennifer was coding late one night when she suddenly felt overwhelmingly tired. Not sleepy tired, the kind of exhaustion that makes you feel like your bones are made of lead. She also felt nauseous, confused, and had this strange sensation like her brain was swollen. Jennifer's roommate found her sitting at her computer, staring blankly at the screen. When asked what was wrong, Jennifer said something that saved her life. "I don't know. But this feels different from anything I've ever experienced." That roommate had watched a video about women's stroke symptoms just weeks earlier. Instead of suggesting Jennifer get some sleep or take some Tylenol, she looked at Jennifer's face, noticed the subtle asymmetry, and called 911 immediately. The paramedics were skeptical. Jennifer walked to the ambulance. She answered questions coherently. She seemed completely normal. But her roommate insisted something was wrong. And that insistence saved Jennifer's life. The brain scan showed a massive clot blocking a major artery. Jennifer was minutes away from devastating, permanent damage. Today, she's back to coding, managing teams, living her full life, because one person took her different feelings seriously. 3 women. 3 strokes. 3 completely different outcomes. Lisa lost her voice. I barely escaped with my life. Jennifer made a complete recovery. The difference wasn't the severity of the strokes. The difference wasn't their age or health status. The difference was recognition. Someone, somewhere in the process, recognizing that women's strokes don't look like men's strokes. Now here's what's going to empower you. And this is why I'm risking everything to share these stories. Every woman I've told you about had the same types of symptoms, symptoms that are almost never taught as stroke warnings, but occur in up to 80% of women's strokes. Sudden, overwhelming nausea that hits like a freight train. Not the gradual queasiness of a stomach bug, but nausea, so severe it doubles you over. Exhaustion that feels like someone drained every drop of energy from your body in seconds. This isn't I need coffee tired. This is, I can't hold my head up exhausted. Dizziness that makes the world tilt and spin, even when you're sitting still. Not lightheadedness from standing too quickly, but room-spinning vertigo that comes from nowhere. Confusion that makes simple tasks feel impossible. Like Jennifer staring at her computer screen, unable to remember commands she'd used thousands of times. Sudden, sharp pain in your face, neck, arms, or chest that has no obvious cause. Pain that stops you in your tracks and makes you think. Where did that come from? Severe headaches that feel different from any headache you've ever had. Not worse necessarily. But different. Like Lisa's headache that felt like her brain was swelling. And here's the symptom that shocks everyone. Sudden, persistent hiccups combined with chest pain or nausea. It sounds bizarre, but it's a recognized stroke symptom that affects the brain stem. But here's the crucial part that could save your life right now. These symptoms don't happen in isolation. They cluster together. They come on suddenly. And they feel different from anything you've experienced before. When Lisa felt nauseous, dizzy, exhausted, and confused all at the same time, that wasn't four separate problems. That was her brain screaming for help in the only way it could. When I felt the room spinning, the overwhelming fatigue, and that strange head pressure all at once, that wasn't stress or the flu. That was a blood clot blocking oxygen to my brain. When Jennifer felt exhausted, confused, and nauseous simultaneously while doing something she'd done thousands of times before, that wasn't work. Burnout. That was a medical emergency. The pattern is clear once you know what to look for. But we've been taught to explain away each symptom individually instead of seeing them as pieces of a larger, life-threatening puzzle. And we have risk factors that men don't face. Birth control pills increase stroke risk, especially combined with smoking. Pregnancy and the postpartum period dramatically increase risk. Menopause brings hormonal changes that affect our cardiovascular system. Even migraines with aura, which are 3 times more common in women, can increase stroke risk. But here's what gives me hope, and what should empower every woman watching this. Knowledge changes everything. The women who survived their strokes, Jennifer, myself, even Lisa, in the sense that she's alive, we survived because someone, somewhere, took our symptoms seriously. Now you have that knowledge. You understand that women's strokes look different, feel different, and present different challenges. You know that nausea, exhaustion, confusion, and dizziness can be just as dangerous as face drooping and slurred speech. But knowing the symptoms is only the beginning. Because what happens next, how you respond, what you say, who you call, and how you advocate for yourself, that's where the real battle for your life begins. And that battle starts the moment you realize something's wrong. Because every second after that moment is a race against time that most women don't even know they're running. That race against time I mentioned, it started for Rebecca Martinez at exactly 2:17 a.m. on a cold Thursday morning. Rebecca woke up feeling like she was going to be sick. The room was spinning. Her head felt like it was splitting open. And she was so exhausted she could barely lift her head from the pillow. Her husband stirred beside her. "Honey, what's wrong?" And here's where Rebecca made the decision that saved her life. Instead of saying "I'm fine, go back to sleep," which is what 70% of women say in this situation, Rebecca said, "Something's really wrong. I need help." But even making that decision to ask for help wasn't enough. Because what happened next nearly killed her anyway. Rebecca's husband called 911. The dispatcher asked the standard questions. Is she conscious? Is she breathing? Can she speak clearly? Rebecca could answer yes to all of them. She was sitting up, talking normally, explaining her symptoms coherently. The dispatcher's response: "It sounds like she might have food poisoning or a migraine. You could drive her to urgent care in the morning. Or if you're really concerned, bring her to the emergency room. No urgency. No immediate ambulance." No recognition that a 44-year-old woman calling 911 at 2 a.m. might be having a medical emergency. Rebecca's husband made the second life-saving decision of that night. He said, "We're not waiting. Send the ambulance now." That insistence, that refusal to accept it's probably nothing, bought Rebecca the precious minutes that saved her brain. But even then, the battle wasn't over. When the paramedics arrived, they saw a woman sitting on the edge of her bed, talking clearly, walking to the ambulance under her own power. Their assessment: probable anxiety attack or migraine. Non-emergency transport. Rebecca felt her heart sink. Even the professionals were dismissing her symptoms. But her husband, bless him, had done something that every person watching this needs to do right now. He had taken out his phone during those crucial minutes and recorded Rebecca describing her symptoms. Not to post on social media. Not for any other reason than to have evidence. When the paramedics seemed ready to treat this as non-urgent, he played that recording back. Listen to her voice. He said, "Listen to how she's describing this. Does this sound like anxiety to you?" That recording changed everything. The paramedics heard the fear in Rebecca's voice. "The way she said this feels different from anything I've ever experienced." They heard the urgency that gets lost when someone is sitting calmly, trying not to be a bother. 15 minutes later, Rebecca was in the stroke unit receiving clot-busting medication. The doctor told me later that if she had waited until morning to go to urgent care, or if the paramedics had taken her to a regular emergency room instead of a stroke center, she would have suffered massive, irreversible brain damage. Rebecca walks, talks, and lives completely normally today, because two people refuse to accept it's probably nothing. But here's what terrifies me about Rebecca's story. And what should terrify you. Every single person in that chain nearly got it wrong. The 911 dispatcher. The paramedics. Even initially, the emergency room staff. Rebecca survived not because the system worked, but because people fought the system. And most women don't know they need to fight. Let me tell you about the woman who didn't fight. Her name was Patricia Wong. And she was 51 years old when she woke up feeling dizzy and nauseous on a Sunday morning. Patricia was a registered nurse. She knew medical symptoms better than most doctors. But when Patricia felt those familiar female stroke symptoms, she did what we've all been conditioned to do. She found reasonable explanations. "I worked a double shift yesterday. I'm probably just tired. Maybe I'm getting the flu that's been going around." Patricia's daughter called to check on her that afternoon. "Mom, you sound weird. Are you okay?" Patricia laughed it off. "I'm fine, honey. Just a little under the weather." By Monday morning, Patricia couldn't speak clearly. By Tuesday, she was in the ICU. The stroke had been progressing for nearly 48 hours, destroying brain tissue the entire time. Patricia survived. But she never worked as a nurse again. She never lived independently again. She lost her career, her independence, and her identity because she, a medical professional, didn't recognize her own stroke symptoms as an emergency. The difference between Rebecca and Patricia wasn't knowledge. Patricia knew more about medical emergencies than most people ever will. The difference was advocacy, having someone who refused to accept it's probably nothing. But what if you don't have someone like Rebecca's husband? What if you live alone? Or your family doesn't understand the urgency? What if you're the one who has to fight for yourself? This is where everything I've taught you becomes literally life-saving knowledge. First, you need to understand the critical window. From the moment stroke symptoms begin, you have approximately 4-5 hours to receive clot-busting medication. After that window closes, the damage becomes permanent. But here's the catch, that 4-5 hours includes transportation time, hospital processing time, getting scanned, getting diagnosed, and getting treated. In reality, you have maybe 2 to 3 hours from symptom onset to calling for help before that window starts closing. And for women, who are often delayed in diagnosis, that window can be even shorter. So when you feel those symptoms, the sudden nausea, the overwhelming exhaustion, the confusion, the dizziness, the different headache, you cannot wait to see if they get better. You cannot Google your symptoms. You cannot call your sister to ask what she thinks. You call 911. Immediately. But calling isn't enough. What you say to that dispatcher can determine whether you get an emergency response or a suggestion to monitor your symptoms. Here's exactly what you say, and I want you to memorize this. I am your age, year-old woman, and I am having stroke symptoms. I need an ambulance immediately to take me to the nearest stroke center. Not I feel dizzy. Not I might be having a stroke. Not I'm not sure what's wrong. You say I am having stroke symptoms. Those 4 words trigger a different response protocol. They turn a possible migraine call into a stroke alert call. And here's the crucial part: if the dispatcher starts asking you detailed questions about face drooping or arm weakness, you say, my symptoms are nausea, severe fatigue, confusion, and dizziness. These are recognized stroke symptoms in women. I need immediate transport to a stroke center. You're not being dramatic. You're not overreacting. You're advocating for your life using medical facts. When the paramedics arrive, you repeat the same thing. I am having stroke symptoms that present differently in women. I need to go to a stroke center immediately. If they seem skeptical, you pull out the knowledge that could save your life. Women's stroke symptoms include sudden nausea, overwhelming fatigue, confusion, and dizziness. I am experiencing multiple symptoms simultaneously that started suddenly. This requires immediate evaluation. You are not asking for their permission. You are informing them of medical facts. But here's where it gets even more critical. When you get to the hospital, the real battle begins. Because even stroke centers can miss women's strokes if you don't know how to communicate. The triage nurse will ask you to rate your pain on a scale of 1 to 10. Don't say 3 because your head doesn't hurt that bad. Say, my concern level is 10 out of 10, because I am experiencing multiple sudden onset neurological symptoms. When they ask about your symptoms, don't just list them. Connect them. I suddenly developed severe nausea, overwhelming fatigue, confusion, and dizziness all at the same time approximately, time ago. These symptoms came on suddenly and feel completely different from anything I've ever experienced. Use the word suddenly repeatedly. Use the phrase different from anything I've experienced. These are trigger phrases that medical professionals are trained to recognize as potential stroke indicators. And here's the phrase that could save your life: I am concerned. I am having a stroke with atypical presentation. I need a neurological evaluation immediately. You're not diagnosing yourself. You're requesting appropriate medical assessment based on your symptoms. But beyond knowing what to say, you need to know how to prevent these conversations from ever happening. Because 80% of strokes are preventable through lifestyle changes that most women don't know about. Your blood pressure is the single most important number you need to know. Not your weight. Not your cholesterol, your blood pressure. High blood pressure is responsible for more strokes in women than any other factor. And it's often completely silent. Get it checked monthly. Not annually. Buy a home monitor. Know your numbers. If your blood pressure is consistently above 130/80ths, that's not a little high. That's stroke risk accumulating in your arteries every single day. Your cholesterol matters. But not the way you think. It's not just about the total number. It's about the ratio and the particle size. Ask your doctor for a complete lipid panel, including HDL, LDL, and triglycerides. Know these numbers and track changes over time. If you're on birth control pills, especially if you smoke, you need to have a serious conversation with your doctor about stroke risk. The combination of hormonal contraceptives and smoking increases stroke risk by 700%. 700%. If you get migraines with aura, those visual disturbances that sometimes come before headaches, you have a higher stroke risk than women who don't. This doesn't mean you're going to have a stroke. But it means you need to be extra vigilant about other risk factors. And here's the lifestyle change that could cut your stroke risk by 70%: regular exercise. Not marathon running. Not intense gym sessions. 30 minutes of walking. 5 days a week. That simple change, something you could start today, reduces stroke risk more than almost any medications. But the most important thing you can do right now, today, while this information is fresh in your mind, is share it. Share it with every woman you care about. Your mother. Your sister. Your daughter. Your best friend. Because somewhere right now, a woman is experiencing those weird symptoms we've talked about. She's feeling nauseous, exhausted, confused, dizzy. She's trying to decide if she should call someone or just go to bed. If she's lucky, she'll remember this conversation. She'll remember that women's strokes look different. She'll remember to say I am having stroke symptoms, instead of I don't feel well. She'll remember that her life is worth fighting for. Even if, especially if, everyone around her is saying it's probably nothing. Because it's never nothing when your brain is trying to tell you something's wrong. And now you know how to listen.